Hello, welcome back to the channel, and thank you for joining me today. We've got an important development coming out of Southern Africa that touches on both healthcare and migration. Doctors Without Borders, also known as Médecins Sans Frontières, is calling for urgent action after reports emerged that anti-migrant groups have been blocking access to essential medical care for foreign nationals across the region. This is a very serious situation, and it's raising tough questions about human rights, public health, and the way societies respond when resources feel stretched. Please listen right through until the end so you can hear the sources yourself and try to verify the news. And if you haven't yet, make sure to subscribe to the channel so you don't miss more updates like this. So, let's unpack what's happening here. For those who may not be too familiar with the work of Doctors Without Borders, they are an international humanitarian organization that provides medical care in crisis areas all over the world. They step in when healthcare systems are overwhelmed or when people are being left out of access due to war, poverty, or even politics. In Southern Africa, their concern right now is that some groups opposed to migrants have been actively preventing foreign nationals from accessing clinics and hospitals. According to reports, in some areas migrants have been chased out of healthcare facilities, intimidated at entrances, or told outright that they will not be treated simply because of where they come from. This situation is especially concerning because healthcare is not just another service, it's a basic human right. Whether you are South African, Zimbabwean, Mozambican, Malawian, or from anywhere else, when you fall ill you need access to treatment. Denying someone that could mean the difference between life and death. And in cases involving infectious diseases such as tuberculosis or HIV, which are both highly prevalent in the region, blocking access to treatment doesn't only affect the individual but could also affect the wider community. If people can't get the medication they need, the risk of further spread increases dramatically. Doctors Without Borders is warning that if urgent steps aren't taken, this issue could spiral into a public health disaster. They have been very clear in their call: governments must ensure that everyone, regardless of nationality, has access to essential medical services. They also emphasize that health workers should be able to do their jobs without interference or intimidation. Unfortunately, some healthcare workers themselves have reported facing harassment when they try to help foreign nationals. This adds another layer of fear and difficulty to an already fragile situation. Now, let's be honest, this whole debate isn't happening in a vacuum. In South Africa and across parts of Southern Africa, migration has become one of the most heated topics. Locals often feel that foreign nationals are putting too much pressure on already limited resources, including hospitals and clinics. There's frustration when queues are long, medicines run out, or staff are stretched thin. Some communities believe migrants are unfairly benefiting while citizens are left waiting. This anger is what fuels groups like Operation Jugula and others who have been pushing for stricter measures to limit services to non-citizens. On the other side, human rights groups argue that the idea of shutting people out of life-saving healthcare is simply unacceptable. They stress that healthcare is not something you can ration based on nationality. As Doctors Without Borders put it, sickness does not recognize passports. When someone collapses with a severe condition, the question isn't where they are from, but whether they can survive if treated on time. The clash between these two viewpoints is at the heart of the growing tensions we're now seeing. Governments across Southern Africa are walking a very tight line. On one hand, they are under pressure from citizens who want priority treatment and feel they are competing with foreigners for limited resources. On the other hand, they are bound by international agreements, humanitarian principles, and their own constitutions to treat everyone within their borders fairly. It's also worth remembering that migration in this region has a long history. People have moved across borders for generations, often due to economic hardship, political instability, or health crises in their home countries. Zimbabweans, Mozambicans, Malawians, Congolese, and many others have long sought work and refuge in South Africa, Botswana, and other states. This isn't a new phenomenon, but the current economic challenges, unemployment, and inequality make it feel sharper and more visible today. So where do things stand now? Doctors Without Borders has urged both governments and civil society to step up. They are asking for stronger protections for healthcare workers, campaigns to educate the public about why universal access to healthcare is vital, and immediate action to stop intimidation at clinics and hospitals. They also call on leaders not to politicize healthcare but to treat it as the non-negotiable necessity it is. But let's take a step back and look at this from a practical perspective. Imagine a pregnant woman being turned away at a clinic just because she's not a citizen. Imagine a child with a fever being denied care. These aren't just statistics, these are real human beings, with lives and families. And here's the reality: if someone with a contagious illness isn't treated, it doesn't just affect them. It spreads, and eventually, it reaches citizens as well. So, in a way, ensuring foreigners get treatment is not just about compassion, it's about protecting everyone. That said, we can't ignore the frustrations of local communities either. Many South Africans feel they are waiting longer for appointments, struggling to get medicines, and sometimes being overlooked themselves. Their anger stems from a lived reality of poverty and inequality that can't be brushed aside. This is why it is crucial for governments to invest more in the healthcare system overall, so that it can meet the needs of both citizens and migrants. When the pie is bigger, there is less fighting over who gets the bigger slice. This issue is not going away anytime soon. It will require balanced leadership, clear policies, and a strong commitment to fairness. In the meantime, Doctors Without Borders says they will keep advocating and supporting both migrants and locals who are in need. They've worked in war zones, refugee camps, and epidemic centers all over the world, so they know the dangers of excluding people from healthcare. Their message is simple: access to medical care should never be negotiable. So, to everyone watching, stay informed, stay kind, and let's remember that healthcare is something we will all need at some point in our lives, no matter where we come from. All images used are for illustration purposes only. News sources: Doctors Without Borders, Daily Maverick, Health E! News, Times Live.